Hello, my name is Dr. Mohsen Umrani. I'm a co-founder at Canarmony Corp, the developer of OPT, which stands for Online Psychotherapy Tool. This work is based on the research done by my wife, Dr. Nazanin Alavi, on evaluating the effectiveness of the delivering CBT using email. In 2015, we have decided to develop a secure and a scalable platform to bring this therapy to as many patients as possible. This small First Nation reserve, 1,000 kilometers north of Toronto, shook the news 2 years ago in Canada. In a span of 6 months, more than 100 people of the 2,000 population committed suicide, many of them kids and teenagers, bringing the crisis of mental health in remote areas into the spotlight. There are substantial barriers to receiving treatment, like limited access, both geographically and socially, like refugees coming from disaster-stricken areas such as Syria. Other barriers include the cost of therapy and, more importantly, the stigma with mental disorders. With ever-increasing access to the internet, OPT is trying to overcome geographical and cultural barriers by connecting psychiatrists and therapists with similar backgrounds with those in need. OPT can also lower the cost of therapy through lowering the overheads and streamlining the therapy process. It could also decrease the stigma through avoiding the traditional clinical setups. Canarmony has worked with experts in online psychotherapy to build a state-of-the-art, clinically validated, pre-designed therapy modules and match them with in-depth data collection capabilities, allowing psychiatrists and researchers to provide expert therapy and monitor results. OPT saves clinician time, allow patients to respond from anywhere at any time of the day, and provide a valuable research tool for clinical researchers. Despite the long waiting time to see a psychiatrist, approximately 30 to 40% of appointments tend to be no-show. The revenue model is based on the assumption that doctors will be able to exploit 2 hours of their downtime per day to provide 6 online 20-minute sessions at the rate of $80 per session. Assuming a psychiatrist works 5 days a week for 46 weeks per year, this system generates an additional $110,000 per year revenue through providing psychotherapy service to 100 extra patients. With a mere rate of $100 per patient per year, OPT could generate an annual revenue of $10,000 per doctor. Our strategy for the first 2 years is to pursue mental health clinics with more than 5,000 patients that would each have about 10 psychiatrists on staff. There are about 400 clinics in Canada that would fit in this category. This would generate a market cap of $40 million per year in Canada alone. These numbers are at least tenfold bigger in the US market. Thank you for your time. We hope that with help of the APA Innovation Lab, we can take this platform to the next level.